This conference will now be recorded.
Hi, welcome to the webinar. Welcome to Women Power and Trauma. This is a webinar presented by Surviving Race Intersection on Injustice, Disability, and Human Rights. We are proud to present Teena Brooks, Celia Brown, and Cheryl Sharp, and Jane Tobler as our host and facilitator today. This recording is available on social media as well as by email and also on YouTube. Thank you so much for attending, and now I'm proud to present Jane Tobler.
Thank you, Jen. We have 3 stellar presenters to share their experience and expertise on women, power, and trauma. Cheryl Sharp, Celia Brown, and Teena Brooks. We'll show you their bios so you can learn a little bit more about them. And at the end, we'll have a panel discussion with them and ask a few questions. Our first presenter is Cheryl Sharp, MSW, ALWF, CEO of Sharp Change Consulting, Inc., and exclusive consultant to the National Council for Behavioral Health, Trauma-Informed Services, and Suicide Prevention efforts. As part of the Trauma-Informed Care team, Cheryl works nationally to facilitate trauma-informed care learning communities and is a content expert on trauma, resilience, and TIC implementation. Cheryl is a person in long-term recovery from mental health and addiction challenges. We are delighted to have her with us today. Welcome, Cheryl.
Thank you so much, Jane, and thank you, Jen, for inviting me to participate in this webinar. Before I get started with my presentation, I want to say a little bit more than what we can say in a bio about who I am and why this work is so important to me. As Jane said, I am a person of lived experience and have been really working hard on healing trauma since I'm 62, just to be clear, so I've been working on that since I was in my late 20s, trying to understand what some of the issues were that I had and why I had them. Was there just something wrong with me, or and it was not until I was introduced to the concept of trauma, and that started out of the work of Judith Herman way back 1987, 88. And that particular book had a profound impact on me. Just understanding that everything that I experienced, who I was as a person, was really impacted by the things that had happened to me. I am a 9-time suicide attempt survivor, and that's, a lot of people go, oh wow, that's a lot. Someone needs to mute their phone. I'm not sure who, but I'm hearing some background. So as a 9-time suicide attempt survivor, I just really thought that I did not have a place in the world. It was, the last time was definitely the last time. And what I can say is I have an amazing life filled with amazing people. I am, if you met me and spent time with me, you would see that I was probably one of the happiest people you've ever met. And for me to be able to say that, I'm not a big believer in miracles or whatever, but it's not anything that I ever dreamed of for myself. I thought I would be dead by now, if not by suicide, if by one other, some other means. So that's the personal aspect of this work for me. But I have understood that race plays a part in our lives in a way that many people don't want to admit, especially white women of my age. And I'm very aware that I grew up in privilege and that I continue to experience privilege. At other times in my life, that privilege was not necessarily there. When you are a psychiatric survivor, there is no privilege. Everybody is the same, and we don't mean anything to a lot of people. And that, that for me was one part of it. But then also the aspect of being female and being a fairly active female, pretty energetic, and with lots of opinions. I have lots of opinions. So just, just by virtue of that, sometimes the thumb gets put on us as well, and it's difficult. So in terms of why this is important, in terms of why this is so important for me, my work has taught me so much. So as we go through the presentation, as I was putting this together, I was thinking about my history with the National Council, my history in the consumer survivor movement, and just there's so much. Many of us already knew this, but many of us have really struggled with the knowledge that we had and not been recognized within our communities and for our expertise. So Jane, if you'll go to my next slide, please. So, this is out there. This has been out there forever. I was part of the technical experts panel that came up with understanding what, trauma meant and what it meant to other people. And I think that it's really evolved over time as well. I think there's more that we take into consideration. But the three key elements are the event. The trauma results from an event, a series of events or set of circumstances that's experienced by an individual as physical or emotionally harmful or life-threatening, and has lasting adverse effects on the individual's functioning, mental, physical, social, emotional, and spiritual well-being. And I'll talk about all of those aspects as we move forward. What I would like to say about where we are right now in this country, in this world, is it's so obvious the racial disparities that exist in this country. It's been obvious to me since I was in the 3rd grade, and that's another story that I won't take you down that rabbit hole. But I got it during the time that integration was taking place in my little southern eastern North Carolina town, that race was a big issue, and it was not okay with me. So recognizing the historical trauma that people have experienced as by virtue of their race and also by their gender or their sexual preference is huge, and disparity is huge. But when we talk about individual trauma resulting from an event, for me, what that means is that I get to define what trauma is for myself. I can't define it based on someone else's experience. I remember when that particular thing hit me in the face. I was going through a really wonderful alternative program way back in the 80s when my journey began. And there was a woman in my group that had lost her entire family to suicide, and she was the last surviving member of her family. And what that did to me is I just went, well, I must not have gone through anything that was, that's nothing compared to what she went through. So we don't compare our trauma. We simply look at what our experience was: mind, body, spirituality, our emotional, spiritual well-being. And what we know, and the ACEs study, some of you may have heard of the ACEs study. If you have not, that's a really good place to take a look at the impact that trauma has on us over the course of the lifespan. But physically it has a huge impact on us, but the emotional and psychological impact for me was tremendous. I did not believe that I deserved to live in this world. And believe me, that had an impact on me for many, many years. And it took lots of years of hard work to feel like that I've begun to heal. And every now and then it pops up and hits me upside the head, just like it did in the past, but I know what to do about it now. Next slide, please. So in that experts committee, the work that we did is we tried to come up, back when I was there, we only had five guiding principles. But the guiding principles at this time are really looking at empowerment, voice, and choice, that each one of us is the expert on ourselves, and that those who support us are empowering rather than looking at us as if we need to have someone do something for us. So it's much more about support rather than it is about telling people what they need to do, giving people the opportunity to really express what their own needs are. Safety is utmost. Actually, that should probably be the first bullet point, because none of us who have experienced trauma will ever experience healing if we do not experience safety. And safety means different things for different people. There's physical safety, there's emotional safety, there's psychological safety, but we have to feel safe in order to heal. Trustworthiness and transparency. So for me, it's pretty simple. Trustworthiness is, if you say you're going to do something, then do it. If there's a reason you can't do it, then how about letting me know that you can't do it and what you're going to do to rectify the situation. The transparency piece is very much about saying who we are, what we need, and trying to be fully present with each other, whether it's with a person who is a provider or with our community, but to show up as who we are. And then finally, peer support. I would not be alive today if it were not for peer support. That was a pivotal change in my life when I realized that there were people out there just like me who had struggled with all kinds of things and were willing to stand up and be present for me in a way. And some of those people are on this webinar right now. You know, to know that there are people that I could call on and that they would hear me and not judge me. We'll talk a little bit more about cultural, historical, and gender issues, and you're going to hear from Celia and Teena, and they will go into those a little bit more. But you know, I could give you 1,000 books as references, but there are a couple of them. The Body Keeps the Score by Bessel van der Kolk, or I mean, there's just so many good things out there that we can, you know, that we could read. But you know, who we are, where we come from, what our histories are, and then how we've been treated in the world are so important. And then lastly, there's collaboration and mutuality. No one is above me and no one is below me. And that is something that I've had to own for myself, and I want to support other people in owning that space for themselves as well. And we don't do anything, you know, I mean, the level, you know, that we're in a period of time right now with COVID, learning how to collaborate and have mutual respect for each other is so important. Next slide, please. So a wonderful woman by the name of Teena Kane really brought the thought of what's wrong with you, you know, to changing and shifting that from what's wrong to what happened to you. And my added spin on that is we have to look at what's strong and who we are. What do we need to do or find or be in order to support us? And it was one person who literally looked at me one day and said, you know, she had heard my story and she just looked at me and she said, "You're the most amazing young woman I've ever seen. You have survived so much and you are still here and you're still fighting." And then the final piece is, you know, what are my gifts, skills, strengths, and talents, and having people that support me in building on those. Next slide, Jane. Thank you. So this particular slide is near and dear to my heart. I found it a number of years ago. It's from the University of Minnesota, and they have so much on their website about intergenerational and historical trauma. I had the privilege this last summer in August to spend 2 weeks on the Navajo reservation trying to bring trauma-informed services, care, and understanding of trauma. And you know, what I can say is, quite frankly, is it truly broke my heart. I have never seen a group of people who have been through so much, and it continues to go on and on and on. And there's so many things, you know, if we go back historically, You know, there's the piece called there's a long walk, but there's also a march. You know, most people understand the Trail of Tears, but the Navajo experienced the long walk, and their population was decimated at the hands of the U.S. military, and it just the things that were done even after the walk occurred. It was children being taken from their homes, trains riding through the reservations and taking those children, and they don't see their families for another 8 years. It just, I mean, I could go on and on. But this is a wonderful website to take a look at. It also does. There's also a really wonderful piece in the particular video that's mentioned here that looks at the experience of African Americans in a way that is pretty eye-opening. As I said, I live in a place where there is tremendous white privilege, and recognizing that I experienced that myself. And it's real interesting for me when I engage in conversation with people who look like me and kind of from the same socioeconomic experience. So many have so little understanding what happens when that trauma is perpetuated over generation after generation and it's never addressed. Next slide, please, Jane. So when we also in this, you know, again, I mean, I think it's so, you know, it's like there's a stick in the eye of the American public right now, and recognizing that, you know, none of us exist in a vacuum. We do have social, you know, one person is higher up on the social ladder than another. The stress of poverty, the stress of racism, the stress of being a caregiver, the things that happen to us in early life. When I talk about the trauma that I experienced, most of that trauma, a good part of that trauma was medical trauma. I was very ill as a young child, in and out of the hospital for weeks on end. And then I also lived with a parent who struggled with mental health challenges, significant mental health challenges. And I've had the privilege of experiencing forgiveness for my mother, but I also still know that some of those, you know, some of that inborn, those things that happened to me still color how I see the world today. Social exclusion, the idea that because a person is of a certain gender or identifies in a certain way, and then to be excluded from the common dialogue or looking at who we're worth, you know, what our worth is huge. Work, having meaningful work for people is wonderful, but when work is the only outlet you have with work is survival, is pretty difficult for many of us. And we're seeing that right now in so many communities that are experiencing the huge spikes in the coronavirus. I know that we have a community in our county that just had a huge spike, and there are people there. They are Burmese refugees and come here and they live in community, and they do not participate in our whole social fabric, and their work is specifically in meat packing, and we all know what that has done. Being unemployed, you know, I mean, good Lord, I mean, 22 million, 30 million people on unemployment right now is huge. I have a family member that is unemployed and in a low income bracket, and the stress for that family is tremendous. Our social supports, who do we have in our lives that see us, understand us, are willing to show up and be there for us? And that's something I've had to work for many different times in my life, is to make sure that I had true social supports that got me. Addiction, of course, is one of our social determinants, and I'm not hearing a whole lot about the opioid crisis right now, but I have a feeling that that's going to be huge as we go along. Food, not being able to have access to food can be a trauma. having access to food is a way that we support ourselves. And then finally, being able to get to where you need to go to get things that you need is tremendous. So those are just those things are what we need in order to feel like we're a healthy person in our society. And so much of our society does not have the experience of all of those things. Next slide, please, Jane. And then there's wellness. This was developed by a wonderful woman, Dr. Peggy Swarbrick, and it makes so much sense to me, and it ties into that last slide. So when we're thinking about our emotional wellness, we're looking at how we cope with life and create satisfying relationships. So, you know, COVID-19 has not impacted me a lot emotionally, other than what I see on the news, and because I live in a really small rural town that has not had huge impact from COVID. But the emotional impact it has been on so many other people, I cannot even begin to imagine what it would be like to not be able to grieve someone that we've lost, or to be I do have friends who are having to isolate and to self-quarantine. I have a stepmother who was doing that, and I see the impact that that's having on her. Our financial satisfaction and our confidence in our future is critical, and many people in this country right now are not experiencing that. And any one of these pieces that are out of whack can feel like a trauma. Again, the social connections, that's one of the social determinants of health. How do we really see ourselves? How do we develop connections? Do we even know how to do that? Spirituality, I kind of jog around this a little bit, but it's, I do appreciate the expanding our sense of purpose and meaning of life. But when we're focused so much on where are we going to live, what are we going to eat, am I going to be able to put a roof over my head, nobody's here to support me, and I don't feel safe, that's not going to invite a lot of spiritual growth. Occupationally, I am currently now retired, but I have had the wonderful experience of being completely satisfied with what I was doing and feeling like I was making a difference. Physically, really being able to think about what we need, and when we're taking care of our basic needs at the very bottom of the pyramid, we don't have a lot of time to think about our physical activity and are we exercising, or just grabbing something to eat, how much sleep we get, what's proper nutrition. When we talk about who we are intellectually well, it's like, how are we challenging ourselves, thinking about who we are, how do we expand our knowledge and our skills? So right now, my thing during this time is I'm learning to speak Irish, and it's a real challenge. I have a real affinity for Ireland, but it's more challenging than I can say. And then environmentally, we all want to live in a place that feels safe and feels good. And when we walk in, it says, I am home. Next slide, please, Jane. So, before I turn it over to Celia, I just want to talk a little bit about resilience, because any of these places, one of the things that I know about myself is when I first started my healing journey, I had no resilience. Anything that happened to me caused me to go over an edge, and the edge could be different things, whether it was in anger or distress, despair, or just not being able to get out of bed for any given day, or feeling suicidal. I did not have resilience. And what I know is that is something that can be built. I know that resilience was kind of tapped out of me as a young person, but I know that it can be built, and all of us find our own ways to build those things. But resilience is built on having those other pieces in place. We're looking at our mind, our body, our spirit, and our heart. Living from the heart is, for me, this is my wellness tool, I guess, for getting through COVID. I got kind of paranoid at the beginning of all of this because I was afraid there was going to be food shortages, which we're starting now to see. And my wellness tool is I have the prettiest garden I have ever seen. And that's my great joy every day. I'm privileged that I have enough dirt that I can grow a garden. But I found that if I could see something grow or I could have something alive in my home, that changed the way I felt, period. And so building resilience is simply that ability to find the things that support us and the people that support us. So I thank you for the opportunity to present both Jane and Jen, and I'm going to turn it back over to Jane. Thanks.
Thank you, Cheryl. That was very interesting, and I look forward to our panel discussion at the end. We've got your information up there, and I think we'll also be sharing it later. Our next presenter today is Celia Brown. Celia is a founding member of Surviving Race, the intersection of injustice, disability, and human rights. She's a certified peer specialist in New York State and supports others to use their voice. Celia is a psychiatric survivor who was instrumental in developing the first peer specialist civil service title in the country and the first peer specialist in New York. A longtime activist in the movement, she served as the main representative of the United Nations for Mind Freedom International and collaborated with other disability organizations on the Convention on the Rights of People with Disabilities. So welcome, Celia. I will turn it over to you.
Thank you, Jane. Thanks so much. Cheryl as well. Thank you. You want to go to the first slide? Okay. You can go to the second slide. Okay. So I want to reflect and go on a little bit of a journey with my trauma. I do consider myself a trauma survivor still to this day because I still work out not what happened to me, but what's going on with me in the present and trying to look at my experiences and see how far it's taken me. So just a brief history. As a teenager, 16 years old, I was sexually abused, raped. And I remember the time to be a very difficult time, of course, and really not having the support that I felt that I needed. And it's because the people that were around me, including family and friends, really didn't know what I was going through. And because someone does something really violent to me or to someone, they don't always side with the person that is the victim of a crime. They sometimes side with the perpetrator, and I've learned that lessons learned. So I was feeling very isolated and very alone and very paranoid and very exposed because I come from a family where not everybody talks about their feelings in a deep way. Everything is very surface. So there's a lot of secrets in my family, and it's simple things as, oh, did Celia or my brother go to the store and wants to talk about that? That's just one simplistic example. So eventually what happened is that I was hospitalized at 16 in adolescence unit, and I exhibit symptoms, I guess, for the psychiatrist as if I was paranoid, schizophrenic. And that wasn't really happening. I was really paranoid as what was happening to me and feeling unsafe that that incident would happen again. Although it didn't happen again, this was a part of my thoughts. So when I was hospitalized, I was never asked what happened to me. Were you sexually abused, raped? Let's work on your healing. That never happened. Instead, what happened, how I processed that was to stuff my feelings. Um, just deal with it and then just deal with whatever diagnosis that they wanted to give me. It wasn't until I got into the adult mental health system in New York City that I met a woman psychiatrist who was also a resident, and was very interested in my story about my trauma. And we worked on it for a couple of years, and eventually she published about childhood and adult trauma, in her own, not about me per se, but she learned from me to be able to educate other clinicians about trauma and mental health. Next slide. So what's given me hope is eventually I did get the support that I needed, and I had some really supportive family members, mainly my mom, who was always there through thick and thin. Whether she understood what I was going through or not, she was just like a roof to me. So that gave me a lot of hope. And remember, this was like in the 1980s, when no one understood trauma. They didn't understand how it relates to like mental health issues. They were still saying that mental illness was a chemical imbalance. So there were a lot of things that were not learned then, and so people really didn't know how to respond. Next slide. So I think what was complicated for me, not just the act, the event, the violent act, but how do I find my voice and what language do I use to explain my experiences, which I didn't have. Um, so I learned to talk about what Cheryl was talking about is not what's wrong with me, but what happened to me. I think that finding language to describe what happened and who you are is taking me, a couple of years to understand that. But with peer support and family support, and also being believed that something did happen to me, not that I made this up or I'm paranoid, something really did happen to me, and that is an important part in having a voice. Next slide. So yeah, I love this picture because these are some of my peers. Um, that this picture we were this is a part of Surviving Race. We were at a demonstration for Eric Warner in December of 2014, and I felt really supported by being at Washington Square Park as we marched to fight this. So as I said, family peer support has always been important for me. Having friends and having a community that supports you is very important. Next slide. So I want, thank you, Jane. I want to say that I think that I tend to be the historian in the consumer survivor movement, as well as the evolution of peer specialists. And I want to say I'm a little bit of an historian when it comes to trauma uh, with my peers. And so when we were creating, trying to create, like, what does trauma look like for someone who gets re-traumatized in the mental health system? I've met so many wonderful trauma-informed survivor experts I'm going to call. I'm not going to call out their names. And at this time in early 2000s, SAMHSA was working on this notion of trauma. We were already kind of working with it in New York State. We were dealing with trauma and mental health, and that came through some people who work with the Office of Mental Health and wanted to bring trauma to the forefront. Um, so early on, trauma was being defined by trauma-informed survivor experts on what that meant for people, what self-injury meant, and there were some people who did self-injury. It was looked at as this woman wants to commit suicide, but they're trying to numb the pain. And still to this day, I don't think it's fully understood as self-injury. Next slide. So I want to tell you a little story. I I got a scholarship from SAMHSA to go to the World Federation for Mental Health conference in Finland. So I was there, and some other, peers, survivors, were also coming from the U.S. And I remember meeting some, women survivor experts there. We were going to the conference, and the conference was very medical model at the time. So some of the trauma survivor experts said, "Hey, let's create a group. Let's find a room. Let's create a space, and let's talk about trauma." So I was supposed to co-facilitate with another woman who was there, and I was really excited about doing it. We had about 6 people, like 3 people, including myself, from the U.S., one person from the UK, and one person from Germany. And as I was trying to facilitate, um, one of the trauma survivors told their story. And as you know, stories are very powerful. Um, so she was telling her story. She was an older woman. She said the way that she's handled trauma is to move forward, and because she's too tired to deal with it on an everyday basis. And this was an African American woman. So instead of me facilitating, I remember crying the whole time listening to her story, because her story reminded me of my story. Because after a while, I had to move on from the trauma, could no longer work on it, because I had to live my life. I had to be, the mother, the sister, someone, the peer specialist that helps everybody, rather than just always dealing with my story. And I think that's a story that women of color, African American women deal with on a daily basis, that we simply do not have time to work through trauma at times. We have to move past it. Next slide. So how did I become resilient? Well, I have to say the experience I just mentioned in Finland was very, very helpful for me, even though it was kind of sad. It did help me to make myself resilient, that I wasn't the only person really dealing with trauma, that there were other people navigating it and working on it and trying to find a way to uh, be present and support themselves. I think that self-care has helped me to be resilient, and peer support and being a part of the consumer survivor movement has been very important in my life. I think recently, working with Teena Brooks, who's our next presenter on Sister Circles, I found another way to work with other women to heal and to share our experiences and our strengths. Next slide. So just to talk a little bit about this is, I think what happens, and this is brought to the forefront with COVID, that the racial disparities are so apparent now that it's very difficult to witness, one thing, and then the other thing is how does this become resolved? Now, I am someone who has just lost an aunt, COVID, so it comes close to home for me. And but just the healthcare disparities and how uh, women of color, people of color are treated when they go for healthcare, and this has been happening for years, but it's more visible now. COVID is here. So I want to remind our audience that that's happening. And this sometimes brings up um, trauma that's happened in the past. And I just want to say that because this has happened to me, trauma, and being sexually abused, you have to relearn how to be in the world because you didn't live a normal life, like nothing has happened to you. So you have to learn new behaviors. And when things happen, the event has ended, but the ways of handling things, like in the workplace and your relationships, comes out of the trauma that's happened to you, and you have to relearn how to be in the world, and how to get the support you need, and how not to blame yourself for things that have happened to you, and how to not remain silent. A lot of times women of color are made to be silent, or they feel silenced, and they're not able to tell this story because no one really cares about it at times. And this is what we feel. So again, we're stuffing so much in that it's like you can burst without really talking about it. Not that anybody has to resolve what happened to you or to feel sorry for you, but to have a space where you can express yourself about what has happened to you regarding trauma. So I'm going to stop there. I want to thank everybody. Thank you for letting me share my story.
Thank you, Celia. That was very moving, and I appreciate, as I know everybody that is watching appreciates hearing your story and your experience. And I know we'll be speaking with you soon on the panel. Our next presenter today
Okay.
is Teena Brooks. Thank you. Teena Brooks, Teena Alum SW ABD. She is a person with lived experience and Assistant Director of the Office of Consumer Affairs in the New York City Department of Health and Mental Hygiene. Teena worked for 13 years with the Urban Justice Center, an innovative nonprofit that serves New York City's most vulnerable residents. Teena has also worked closely with the New York Association of Psychiatric Rehabilitation Services. She served as a regional organizer from 2000 to 2006 and as co-president of the board of directors from 2006 to 2008. She is currently a lecturer and adjunct professor at Columbia University's School of Social Work. Welcome, Teena, and I will now turn it over to you. Oh, but first I'll remind you to unmute your microphone.
Well, thank you for the reminder.
Great,
Can
thank
everyone
you.
hear me?
Yes.
Great. So I'll go and start. So first, I just want to thank Cheryl and Celia. Just to say that I stand on the shoulders of giants would be an understatement. Just listen to them speak and the substance that they brought to this work. So thank you both. Next slide. So want to talk a little bit about myself and my story. As you see from my bio, I think I've been for a very long time an advocacy person. And I think like a lot of advocacy people, that sort of comes from a place of feeling a sense of injustice and a little sort of indignation about the way the world is. I also was someone who experienced a long history of mental health conditions, have spent a lot of time in the hospital, and spent a lot of time also not really acknowledging, I think, that I was a trauma survivor. And, I have to start by actually just having some gratitude for that realization. And, that sort of goes to the origins of sort of how I've been involved in this work for the past years, and based on some work that I started to do with Kathy Cave and also Darby Penny, based on some work that they did with the Mental Health Empowerment Project. Amy Colsante is the executive director who was able to get this grant from SAMHSA, and it was meant to be creating a grassroots demand for trauma-informed approaches. And the goal was really to do just that, to create this peer-led demand for trauma-informed approaches throughout New York State. Our office started a learning community, which I think is continues to be the only peer-run learning community in New York City right now, just looking specifically at trauma. But I have to say, when I was thinking about starting this work, I remember thinking to myself, oh my goodness, I want nothing to do with this conversation around trauma. It was in 2014, I just gotten out of the hospital and gotten to a point where I was stable, or what I thought was stable for a while, and had started working in government. And I think there's that sense sometimes that when you're living with trauma, you're sort of hanging on by a thread, and anyone brings anything up, it's just going to push you over the edge. And I spent some time really struggling with this idea of trauma, and this is really about just living through a lot of pain. Is there an opportunity for hope? I don't even think I had a concept of resilience or what that looked like at the time. And I have to say, it's been such an important part of my work and my healing as a person. Celia mentioned the work I've been able to do with her on sister circles. That really stems from a lot of the work that I was able to do through the trauma initiative, and really for me to find my own voice and just sort of deal with my own trauma. So I just want to really say that express my gratitude for something that I thought would be really painful, that really was at times painful, but also incredibly empowering. So that's a lot of how I approach, and I'm thinking about trauma and trauma-informed approaches. Next slide. So choosing strength, this is not a new tool, but this is based from a wonderful toolkit that was created some years ago by Kathy Cave, Darby Penny, and one other person whose name I cannot remember, who I'm sure will come back to me, but it's a wonderful toolkit for working with women who are experiencing trauma and trauma-informed peer support. So I just want to start by reading that. Choosing strength. Someone from the women's building came around asking if we wanted to go to a meeting just for women to talk about violence in our neighborhood. The first night 7 women came. The group leader talked a lot about violence and how something that happened way back when I was little can still bother me. I guess I was surprised. Where I live, somebody got beat up almost every day. I didn't say much. They asked me, would I come back again? I guess so. But like, hey, I said, leave. Then I will come back. I can't have pity. No feeling sorry for me. Don't even look at me with sad eyes. I have to go back there and be a strong woman. Take care of my kids and be strong. And it really, that resonates with me so much, listening to Celia talk about her story. And I think so many of the stories of women of color and African American women, I know for me, a lot of what was important to me is being able that I could still function and be all the people and all the different type of roles I want to take on as a woman and as a Black woman. And in the ways that can be really empowering, but that also kept me a long time from really thinking about trauma, because being a trauma survivor to me was at that time about weakness, and I couldn't think about how to integrate it into all the pieces of who I am as a woman, as a Black woman. And that's been a big part of my journey in really understanding trauma and the impact of trauma and power. Next slide. So women trauma, power and trauma, thinking just about approaching this topic and really just thinking about, I think about all the wonderful things that I think have happened in this movement. It's wonderful to hear Cheryl sort of talk about the origins of some of the work, and Celia as well. But there's also a really clear reality that we're not where we want to be. And as Celia alluded to, and Cheryl, there are real disparities for women. So we don't come into this work equally, and the power is not shared equally. And our trauma as a result, it's something that women really just experience in very unique ways. For example, just our rights to control our own bodies by having the right to choose and things of that nature, the right to vote, still fairly new in this society. So we're already coming in historically in a place where women have not been perceived as equal. So there's already that imbalance, medicalization of women's experience. I think Cheryl sort of alluded to this. When we talk about our experience as women, there's still an expectation that it means a certain thing. There's a long history of women being perceived as emotional, and that emotional behavior being really medicalized in a way. People have probably heard the phrase like histrionic, and some of the language have been in the DSM, and some of that work really comes from a place of medicalizing women's experiences in a way that's really marginalizing and really discriminating of who we are as women, our lived experience somehow being more likely to be crazy or criminalized in certain ways. And I'll talk a little bit more about that lately. But there's that history of women really not coming into the world with equal footing. Physical dominance, socialization practice based on physical dominance, what it means to be a woman, how we associate womanhood with certain things around strength or not having strength, and really sort of how that plays out in terms of relationships and patterns of abuse. One thing that we've heard a lot about during COVID-19 that's really disturbing is the increase in domestic violence. And certainly there are a lot of reasons that likely contribute to that increase, but those gender-related roles and issues that have played out historically contribute to that. I think it becomes exacerbated when we're in situations where we sort of have to be in this quarantine state, and we start to see some of these things that we know were happening are now becoming much more visible and getting much more attention than we would hope to see, given the work that we've done around domestic violence, to really move forward with that work and really advance the rights of women. Involvement in the criminal justice system. I think we're just starting to talk about this more, this idea that more women are entering the criminal justice system, often because of their relationships that they've been in and things that they need to do because of the relationships that they've been in to survive, things about like being involved in the drug trade, and all sorts of things that have contributed to them being involved in the criminal justice system. And there's a very much used statistic that the majority of women who are in the criminal justice system or justice involved identify as trauma survivors. And I think certainly there are many men who are justice involved who do also identify as trauma survivors, but there just isn't the same level of space or comfort or destigmatization to help them feel comfortable and identifying as trauma survivors. So I wanted to really talk about that and really frame this idea that it's wonderful we're having these conversations, but this is part of the reason why we are having them, these real sort of disparities that women face that really put them in situations where they experience trauma potentially at a higher rate. Next slide. I also wanted to talk, and thank you again, Cheryl and Sue, for talking about this idea of trauma. And so Cheryl talked about historical trauma, and Celia, you talked a lot about your experience in terms of trauma. Really wanted to sort of introduce this idea of racial trauma that we're talking about, because I think it's really important for people and women of color, as we start to think about our experience with trauma, is to really think about what it means as women of color and how it really impacts us. And this is a really great article on racial trauma that's been widely cited, but I think that the definition is really helpful here. Racial trauma is one term being used to describe the physical and psychological symptoms that people of color often experience after being exposed to stressful experiences of racism. Similar to survivors of other types of trauma, sexual assault survivors, people of color often experience fear, hypervigilance, headaches, insomnia, body ache, memory difficulty, self-blame, confusion, shame, and guilt after experiencing racism. And I think it's really important to really spend some time sort of thinking about what this means. As we talked about historical trauma, I think sometimes when we think about racism, we don't necessarily name it for what it is. It's something that really is traumatic and has a real impact on us, on our mind and our bodies, in very much the same way other types of trauma does. And really creating space to be able to own that is a really important step to being able to move forward in terms of healing and thinking about what resilience needs to look like. Next slide. So when we're talking about surviving racial trauma, some of the things to really think about is first just acknowledging it. As I mentioned, I think we deal with so many microaggressions and forms of things that become traumatic and we experience as traumatic. And it's been such a part of our history, and I'm saying this as an African American woman, that we don't really acknowledge it. It becomes a part of everyday behavior and just the reality of our experience. And we know as we start to learn more about trauma, there's a real impact and a consequence for not acknowledging what's happened to us. It does a toll on both, it takes a toll on both our minds and our bodies. Discussing one of the things through Sister Circles that I really wanted to do is just create space to be able to discuss some of the things that hurt us as women of color. I think the discussion allows us to identify these things for what they are, to understand them as things that are traumatic and normalize them in a way, not that it's acceptable, but we're able to say, yes, that happened. And yes, we need to talk about that. And yes, we need to take some steps to think about how to remedy it, even if we don't know in the moment what that looks like. And that's also part of seeking support, building networks, building communities. I think for me, a real struggle and a lesson learned thinking about COVID-19 is what does it mean to really have community? What does support look like? I have mental health treatment that I seek, but what does my broader community look like? And where does the survivor community fit into that? And how can we really start to look at these things and come together? And this has really challenged me. COVID-19 has really challenged me to think about what does that look like? And what sort of steps can I take? And what sort of networks do I have the capacity in my little corner of the world, New York City, to start to think about building? Self-care, we talk a lot about self-care. I know as a social worker, I talk a lot about self-care and probably have not practiced it as well as I might like to before COVID-19. But this has also, again, really pushed me to think about what does it mean to have self-care as a strategy to really survive racial trauma and survive in the world as an African-American woman. How do I build community? And empowerment through resistance. One of the things that I think is always a little tricky, especially as women of color, this idea of resistance and what does it mean to be angry and how do we use that? I think there's that history of racism that ties the language around resistance to threat and anger, and thinking about how we can use our voices to really be empowered and to be resistant and really promote change. I think that's some of the work that's really exciting about surviving race and the opportunity to really build some of those spaces for women to come together and really have some of those opportunities. Next slide. So I just wanted to close a little bit just by talking about just some of that, and I'd mentioned in earlier slides, some of the things that we're seeing around gender trauma and COVID-19. I mentioned gender-based violence increased during emergencies involving quarantine. Some of the issues that we're also seeing in the news, just women being able to have access to resources when they're pregnant, being able to have people who are with them in the birthing room, but also some of the other disparities that we've seen play out with women, in particular women of color. It's just being able to be heard during their pregnancies by medical professionals. And this is not anything that that's new. We've heard a lot about this, some of the disparities in pregnancy among women of color and not being treated or heard by doctors when they've talked about symptoms, and just experiencing disparate outcomes as a result, loss of their infant mortality. So things that we're also really being mindful of and thinking about now in this pandemic. And just reduce access to family planning and mental health care services. And one of the things that's unique for women in this pandemic is that not unique in the sense that we hold a lot of things together in our communities, in our homes, and that's not changed in light of COVID-19. I think we're seeing even more of that to become more apparent. You know, we see the clips about the women saying, I'm also now the substitute teacher, I'm the meal planner, and I'm playing all these roles now and dealing with whatever I had to do before. Maybe that's balancing my professional work, but now I have this new sort of set of demands. And again, as women, we are, I think, the ultimate multitaskers, but this pandemic has really created some, I think, real hardship for women that I don't, I'm sure that we'll see the consequence of moving forward as we start to think about trauma and really trying to help sort of address the needs that women may express moving forward. The other thing that I want to mention is that women are more likely to be frontline healthcare workers in the variety of different healthcare roles that we play in healthcare things. So there's a real need for specific, women-specific, I think, resources to help us really think about how to heal from trauma, and just thinking about some of the trauma that we may well experience moving forward in light of the pandemic. Next slide. So making the pitch for sisterhood, I sort of started out thinking about this, really feeling like, the work around trauma really is about women, and certainly want to always partner with anyone who wants to work in solidarity to address some of these issues, and that includes men. But I think there's some things about the trauma-informed movement that really speaks to me around sisterhood, this idea that women are more oriented toward relationships and connections. And that's always been, I think, sort of a loaded idea, because I think sometimes those ideas are used against us as women, or are really challenged as being less than. But we are, as I mentioned previously, sort of the people who do broker and foster a lot of relationships, and we value connections. And really everything that we've talked about throughout this presentation is really important and about building community and really thinking about cooperation and collaboration and connection. Every thread that I've heard throughout the presentation has really been talking about what does it mean to be part of a community, and how do I work with other people to really heal, and how do I build those sorts of collaborations. So I think that is such a critical concept, and I think women, because of the way we are, often are so well positioned to sort of be leading this and guiding a lot of this language. Next slide. So wanted to leave you also with some real resources. I think for me, and a lot of what I've heard is a thought, a sort of a thing that guides us, it pulls us all together, is this whole idea of finding our voice. And for us, it was really sort of thinking about, what does it mean to be a trauma survivor, and how do I take ownership of that and move my voice into the world? And there's some resources, and certainly there are more resources out there, but there are two that have been I've been working with more closely. The New York State Trauma Informed Network that group has been in existence for a few years, and what they've been trying to do is really coordinate a lot of the trauma-informed work that's happening throughout New York State. I think we all know and we all hear that there are great pockets of work happening here in New York State, but we're never all able to quite come together. And New York State Trauma Informed Network has really been trying to think about how to do that and bringing together trauma survivors, people who are service providers together to really think about, what are we doing? How do we build capacity and how do we build a movement? Another organization is the Campaign for Trauma-Informed Policy and Practice, CTIP. They are a national organization that's been in existence for some time, and they are also part of that voice of trying to figure out how we move toward a country where we have trauma-informed policy and practice. And they've actually started doing a national campaign where they are asking people to come on board and actually be liaisons in their respective communities to engage elected officials in Congress about the need for trauma-informed policy and practice, particularly in light of COVID-19, helping really to think about how can money from the CARES Act actually be used, if best used in the community, and also educating elected officials about the need for ongoing funding. I think if there's anything we've learned so far from this pandemic is that that level of funding and that level of support is going to be really critical as we move forward to really begin to think about some of the trauma that's occurring now and some of the trauma that will also be very evident moving forward, and how do we begin to create policies and practices that are really going to be prepared to meet the need that we know exists now and will continue. Next slide. So I want to thank you again for taking time to hear from me today. And this is one of my big parts of my support. That's Paxton Hamilton, who is my pet. I am a pet mother, and that's been a big part of me sort of being able to heal. He gives me a lot of comfort and is able to provide me a lot of emotional support, and has also just helped me connect to a whole community of animal lovers and people who heal through their connections with their animals. And that's been really healing for me and just helped me feel like I'm able to go out and do wonderful work. So he's curled up in the corner watching me present, and I just want to say thank him and say thank you to you. That's it for me.
Teena, thank you, and thanks for sharing your little puppy with us. We especially appreciate the expertise and experience, especially in light of the COVID-19 situation. We have a few minutes left, so I invite all of the speakers to put their video on and unmute themselves if they're able to. And I actually wanted to start with a question. And Celia, and this anyone can answer this, but earlier Celia had said, she spoke about, oh, after all that, I didn't turn on my own camera. Celia spoke about having once experienced trauma, you have to relearn how to be in the world and relearn not to be silent, and there's a need to tell your story. And I wanted to ask the presenters and Celia, how can allies help open up space for trauma survivors to tell their story? How can allies open that up?
Jane, would you speak to how you're thinking about allies? Who do you see as allies? Because as Celia and Teena were talking, I had a whole nother conversation going on in my head that Jen and I had at the beginning of all this, things that I wanted to say.
Oh, sure. I was thinking that, one of the things Celia talked about was that she was saying there isn't a need necessarily for pity or sympathy, but a need to express the story. And I was thinking as, for people who maybe aren't peers or are peers, but, who are who maybe haven't experienced, but what can they do? What can anyone do to help open up space, to help be a good listener to that story, that
Thank you.
history?
That's perfect. And I'll be very brief. You know what? Just asking people, you know, just asking the question, would you tell me your story? You're such an interesting person. I'm sitting here and you know, we've been working with Celia and Teena, and I've known of them, and of course I've known you forever. You know, it's like, I really would like, you know, the stories are what make us who we are.
That's
And,
right.
and it doesn't have to be the story of the trauma. It's just the story of who are we, and who are we in relationship, and who are we in relationship to the rest of the world. So that's my 2 cents. Thanks.
Thank you, Jane, for that question. And I agree with Cheryl. It's like anyone who really supports you, wants to hear your story, doesn't want to judge, and just kind of listens. And I think
Mhm.
that's something that I'm learning through Sister Circle, is that people are able to share their story without anybody else commenting on it. It's that's your space. You can say how you feel. And some of us may resonate with it, some may not, but you're able to have a voice. So I think that's important.
Great, thank
I
you.
would I absolutely agree. I mean, one thing that's really important for me, yeah, definitely listening, but also just really thinking about, are you ready to listen? And if you're not, being able to say, that's okay. Maybe another time, maybe we can have that conversation at another point when we both feel like we're in a different place. I think sometimes we want to show up and we want to support each other in the work, and maybe we aren't ready to do that, and that's okay. I think the other thing that's really important for me too, in terms of just really listening, is not, I think sometimes I know because of probably because of social work background, and listening with the thought of like, well, how can I fix it? So what can I do? What can I
Mhm.
say? And it is
Mhm.
really just about hearing it and sitting there and hearing it and knowing that there may not be an answer and there doesn't need to be.
So one other thing, as I was thinking, Tina, as you were talking, IPS, intentional peer support. I mean, I was clinically trained and masters in social work and all that jazz. But the thing that taught me most about how to be in relationship with people who have experienced great difficulty was IPS. And when we think about how we listen, we have to listen without judgment or blame, and to be really open to sometimes hearing things that are uncomfortable, and being able to say, you know, I hear what you're saying, but it makes me a little bit uncomfortable right now. Could we come back and revisit this? I mean, IPS creates such a different opportunity to how we have conversations with each other. And I found it to be very helpful for me in every relationship I've ever had.
So very true.
So I had another, I wanted to share, Cheryl has shared this quote. And Cheryl, to be perfectly honest, I don't remember when, and it could be recently, it could have been years ago, but it came up when I was looking into this. And I just thought, in light of the COVID situation, just to think about it, if there's anything that speaks to the three of you. But Cheryl, your quote was, "Peace, it doesn't mean to be in a place where there is no chaos, struggle, or hard work. It means to be in the midst of these and still be calm in your heart." And I feel like, with this webinar, Women, Power, and Trauma, it is a very heavy topic. It's a lot. And when I found the quote, especially in light of not just the webinar, but the situation we are all living in, which is not anything that we've ever lived in before, that anyone living has lived in before. So I just wondered, how do you see that now?
So that quote, I have to give credit where credit is due, and it is an Anaya Nin quote, and she's an amazing woman. And that quote, I guess the best way to explain it is that quote came to me when I was in the midst of losing the love of my life to stage 4 non-Hodgkin's lymphoma. And I was traveling all over the country, sometimes in other countries for work. There were lots and lots of things that would come up that felt like the end of the world. And realizing that if I did not bring my peace and my calm and my well-being to the situation, it would be completely out of control. And so Jen is familiar with this, the quote that I always use after that. So the one by Anais Nin is all about being calm in the midst of great challenge, because then you can make decisions about what you want to do if you're able to stay calm and in the moment. But the other one is nothing is the end of the world except the end of the world, and this ain't it. At least not today. It's felt like the end of the world for the last 2 or 3 months. It's not the end of the world. We'll get through this. It might not be pretty, but we will get to the other.
Teena or Celia, did you want to say anything on that? You don't have to. It's fine.
Yeah, it speaks for itself. I don't know that there's,
Okay.
Yeah, I think I agree. It speaks for itself.
So Teena, when you were giving your presentation, you talked about the long history of medicalizing and marginalizing women, and then, kind of adding to that, then the racial trauma. And I would say, I think one thing I would be interested in your thoughts on is, going back to that part of it, what can people do to help those going through that, right? We do know that this is happening. So what can other people do? You kind of talked about, sharing and quote, normalizing it, not in a way to make it normal, but to say, hey, this happened. So can you speak a little bit more about that part? If you were going to give advice to someone, if someone said, hey,
Sure. I mean, for me, it's been important, whatever setting I'm in, to really show up and create some opportunities to have those conversations. Even thinking about being in the movement, and Cheryl, I'm sort of thinking about a comment that you talked about, this idea that in the movement we're kind of all held equal because we have this kind of shared oppressor, which is the psychiatric system. And I'm quoting you not well, and I apologize for that. But even within that world, it's not, the experience is not equal. It's not equitable. Just going back and thinking about my experiences in the mental health system, definitely saw a lot of disparities and how I work with peers and how that plays out. So for me, it's really important to first sort of own what's going on and really to think about how you can have a voice in creating some of that change. And that's not always easy because I don't think we're always in a position where we can do that, or maybe it feels safe to be able to talk about some of that racial trauma, but really starting to call it out in our own movement. I don't think we can really have a broader conversation if we don't deal with our own stuff. So that for me is something that's felt really important. In whatever space I'm in, I make a commitment with myself that's going to be on the table, and trying to start some of those conversations is a really important part of work that I need to do.
Great, thank you.
I want to thank Teena for bringing that up, racial trauma, in your presentation. And I think it's good that it's a definition and what it really means. I think that helps people understand it. And again, find the language that I talked about in my presentation. Sometimes we don't have the language to describe all of this. And I'm glad that you were able to define it with a definition. I think that's a very good step. And so thank you for doing that.
One of the things that I feel like I have gained out of this webinar and listening to the two of you speak is just that realization, not the realization, it was such a moment in time for me when I got it. You know, I mean, because I did come through the consumer survivor movement, and you know, and I owe so much around so many things. The thing that stands out in my head for me around my privilege and around being a white middle class woman has been in 2016, on January 20th of 2016, I finally figured out that I needed to sit down, shut up, and listen with an open mind and an open heart. I mean, I've always been a kumbaya kind of girl where we all gather around, we love each other, and we be together. But I really got it that the African American experience, the Native American experience, and the Latinx experience is very different from mine. It's in the consumer survivor movement and then just about every other place. And so I have been on a journey of trying, I'm going to get emotional, of trying to hear that experience and to understand what that really means. Oh, I'll stop there because it's a big.
Yeah. And I think what's really been super and great, Cheryl, it's wonderful to hear you say that, but really creating that sense of history. You know, I love being in Celia's presence because, as she mentioned, she has sort of been that historian and held that history. I'm really thinking a lot about how does that history live and move forward. I mean, once we're all gone, and really creating that sort of sense of shared history and idea of where we are in this movement. And I have to say, in the conversations in the trauma-informed community as well, I think there's that sort of fear or concern about being that honest about the fact that the realities and the experiences are different. And how do I own that without being part of the problem? And, you know, I think your willingness to what you're talking about, just listening and hearing, is a really important first step.
Yep.
Yeah.
And what you were taught, Jane, earlier, you were talking about allies, and this is what took me back to my early conversation with Ken. And one of the things that I've seen in our movement is we kind of eat our own young. I don't know if that makes sense to anybody else, but
Yes, it does.
whatever group we belong to, for whatever reason, maybe it is humanity, and hopefully women can bring people along on the journey, because women are more collaborative, but we still do the same thing sometimes. And whether it's us against males who are truly our allies, who want to see us move forward, who are going to support us. I mean, by God, there better not be a man in my world that's not doing that. But that we really have to do that with each other. That, you know, is that, I mean, I guess again, it goes back to stepping back and listening and thinking about who our allies really are. You know, I mean, when I think about Judy Chamberlain and Nothing About Us Without Us, well, that's everybody. You know, if I can't have a voice at the table and you can't have a voice at the table, and anybody else who's different from me can't have the voice at the table, we're not going to move forward at all.
Yeah.
All right, well, we are almost at time, so I'm just going to ask our excellent presenters if there was anything else that you want to share one last thought with everyone. You did excellent presentations, so I don't want to take away from that. But is there one last thought of what we can carry forward today if we took one thing?
I would say validation, because I've been thinking about that a lot. But your story, my story, needs to be validated, and that was a big part of my journey, is my story being validated, it being believed, me not feeling like invisible to everything that's happening. So I would take that on, forward. That I would think that validation is something that we can move forward with.
Validation. Thank you, Celia. Absolutely.
For me, resistance is still, that's the word I'm stuck on. And resistance in the sense of how we take the work, particularly specifically the work around trauma and being trauma informed, into something that is part of a social justice movement. I don't know that we've done that as fully as I might like us to. I think we talk about trauma, and I think this presentation is really important and powerful of reminding us of why it's so important to understand and honor the impact of trauma. But I really would love for people to think about, how can I take this out into my life and use it to change some of the systems that I encounter that have been part of my traumatization? How do I find my voice? What does that look like? And it may not be through systems advocacy, maybe it's through advocacy that you do in your community, with your family, but just sort of thinking about what that looks like and what that resistance looks like in the context of change.
Excellent. Thank you, Teena.
I think what I would like to kind of step away with on this, because it's the thing that, it's the reason why I'm still here. And I think about, if each one of us could walk away and think about, what is the one thing I can do for myself today that's going to lead to my wellness, my wholeness, however you think about the person that you're trying to be. And that, for me, I had to give myself all of the things that I could never get from those who were in my childhood that were against me. I have had to learn to be my own mother, my own sister, my own friend, and it is some of the most, like I said, my garden, I'm looking at it right now, and my garden is one of my greatest joys. But there was a time when I had to choose between, will I get meat this week, or will I eat beans so I can buy the flowers? Because the flowers were my gift to myself. I didn't care about the meat. The beans were good enough, but the flowers were magnificent. And the $3.99 bunch that you get. So what is, how do we create? How do we step out as the most well that we can be? I'm not talking about presenting well. I'm talking about truly standing in our own health and our own wellness, and being real and being transparent, and always making sure that that we we take care of ourselves first, so we can go out there and be present for other people.
Well, that is excellent, Cheryl. We are getting to the end, so I want to thank again our excellent presenters, Celia, Cheryl, and Teena. You were wonderful, and I appreciate everyone that is watching this webinar. We thank you for joining us for Women, Power, and Trauma. And if you have learned something or been reminded of something, please do share this webinar with others. Thank you so much, and you have a great day. Bye-bye.
Bye.
This conference will now be recorded.